Hello everyone, this is epidemiology. In this video, measuring the occurrence of disease in the population, we will explore the importance of measuring disease occurrence in the population, some key concepts to be aware of when measuring diseases, how to measure and report disease occurrences in the population. So why is measuring disease occurrence important? Well, it provides us with insights into the health of a population, identifies patterns, and helps in developing strategies for prevention and control. Understanding disease occurrence is fundamental for public health planning and intervention. Let's start with some key concepts to be aware of when measuring diseases. We have distribution, determinants, proportion, rates, ratio, incidence, and prevalence. Distribution refers to the way health events are spread out in a population. It helps us understand if there are certain groups or communities more affected by a particular disease. Determinants are the factors that contribute to the occurrence of a disease. This includes things like genetics, lifestyle, and environmental influences. Determinants may be modifiable, such as sedentary lifestyle, or non-modifiable, such as genetic factors. Now, let's talk about some measures. Proportion is a part-to-whole relationship. Rates express the frequency of a health event in a specific population, and ratios compare two quantities, such as number of deaths from diabetes compared to all-cause death. Incidence measures the number of new cases in a population over a specified time, while prevalence is the total number of cases in a population at a specific point in time. There is a nuanced interplay between incidence and prevalence. This was discussed in one of my previous videos. Cistern analogy, the interplay between incidence and prevalence of disease. Prevalence and incidence can provide information on rate, proportion, and distribution of diseases. One crucial rate measure is the maternal mortality rate, indicating the number of maternal deaths per 100,000 live births. This rate is a vital index of maternal wellness. Likewise, the infant mortality rate aids us in gauging the health of newborns. It represents the tally of infant deaths per 1,000 live births before reaching the age of 1. The proportionate mortality rate is a ratio measure that compares the number of deaths attributed to a specific cause, for example, a particular disease or condition such as diabetes or high blood pressure, to the total number of all-cause deaths in a population over a specified time. It's an effective instrument for recognizing major causes of mortality. We now delve into cause-specific death rates, a pivotal rate measure. It represents the count of deaths associated with a certain cause divided by the entire population, typically expressed per 100,000 population. This measure throws light on the frequency of deaths from a particular cause in proportion to the total population. At this juncture, one may inquire, what distinguishes cause-specific death rate from proportionate mortality rate? Let's clarify. Both these measures offer insights into the causes of death, but the key difference lies in the denominator. Cause-specific death rate takes the entire population as the denominator, denoting the frequency of deaths from a unique cause per unit of the total population. Conversely, proportionate mortality rate uses the total number of deaths as the denominator, representing the proportion or percentage of deaths attributed specific cause compared to all deaths. It offers insights into the distribution of causes within mortality data. In the spotlight now, we have population health indicators, crucial tools that help ascertain a community's or nation's overall health status. These indicators offer a panoramic view of various health aspects, thereby providing a comprehensive understanding of how effective a health system is. To illustrate, let's take a closer look at two such indicators: maternal mortality rate, MMR, and infant mortality rate, IMR. MMR is the number of maternal deaths per 100,000 live births. It acts as a mirror, reflecting the state of maternal health and the quality of obstetric care within a country. On the other hand, IMR indicates the number of infant deaths per 1,000 live births. This metric serves as a key indicator for child health, the country's ability to care for its youngest and most vulnerable, the quality of pediatric care, and the effectiveness of healthcare interventions. These indicators are reported to the World Health Organization and are open for access from the WHO repository. Through the analysis of these indicators, policymakers, healthcare professionals, and researchers can gain valuable insights into the strengths and weaknesses of a nation's health system. This facilitates informed decision-making and the planning of targeted interventions, ultimately aiming to improve overall health outcomes. So, as we can see, these population health indicators are not merely statistical data, they are powerful tools that can shape a nation's health landscape. In the world of public health, measuring disease occurrence is not just a numbers game. It's about gaining a deeper comprehension of the health status of our communities. It's about understanding who is affected, how often, where, and why. These metrics, these seemingly abstract numbers, are real people's lives. They tell stories of health, illness, and survival. They inform us about the collective well-being of our society and the effectiveness of our health systems. By grasping these concepts and utilizing these measures, we are equipped with powerful tools that can help us protect the health of our people and build healthier societies. These numbers enable us to identify vulnerable populations, investigate the causes of disease, evaluate the effectiveness of health programs, and plan for future health needs. They empower us to make informed decisions, to strategize, to intervene, and ultimately to save lives. In this journey of understanding disease occurrence, knowledge is our most potent weapon. It is the first step towards creating a healthier world. So, let's keep learning, let's keep questioning, let's stay informed. And with that, we conclude this segment. Thank you for tuning in, and remember, your journey towards knowledge is a journey towards a healthier world. Stay tuned for more insightful discussions. Voiceover. Before we wrap up, we'd like to point you to some additional resources. For a more detailed understanding of these concepts, we recommend visiting and looking at their comprehensive guide on measuring the occurrence of disease. It's a great platform for deepening your knowledge and enhancing your understanding of disease occurrence. Also, don't forget to like, comment, and subscribe to our channel. Your engagement helps us to continue providing these informative videos. Share our content with your friends, colleagues, and anyone else who might benefit from this knowledge. Remember, knowledge is power, and sharing it can make a significant difference. Until next time, take care of your health and continue your journey towards knowledge. Remember, every step you take is a step towards a healthier world. Thank you for joining us today.